Hey everybody, I'm Sifu Bodhi. Welcome back to my channel. Well, today we are going to be exploring Qigong for menopausal shoulder. And if you haven't already, please do me a favor, hit the subscribe button, turn on the notification, do all the things so we can get the algorithm to pick up these videos. And if you are watching this video on YouTube, please check out bodhimedicalqigong.com, our brand new members website. Tons of content, all the YouTube content, ad-free, plus some exclusive content that's going to be coming every single week there. And our live classes are going to be starting there this coming Saturday, actually, first Saturday of the month. That's going to be there on bodhimedicalqigong.com. So make sure you check out amazing resource of healing information. So menopausal shoulder, what they technically refer to as adhesive capsulitis. It's an inflammatory condition that women often get around their 40s, 50s. And it's a combination of syndromes, which just leads to a whole bunch of really terrible pain. Part of it is what's called TOS, thoracic outlet syndrome. And this is a compression of the brachial plexus, the nerve endings that come from C3 to T1 that branch through your scalene muscles and lead down your arm to your chest, your ribs, to your back, and create severe pain anytime you lift the arm. And because that nerve is now entrapped, you now move the shoulder through smaller and smaller ranges of motion. And when that happens, the joint, you create adhesion, scar tissue buildup in that joint capsule, and it slowly becomes more and more inflamed before it actually freezes. And this is what's also known as frozen shoulder. And so it is a terrible affliction, and millions of women suffer with this. But I'm going to show you 3 progressive programs that you can use to treat this condition. And we're going to use each program for about 2 weeks, depending on your level. Now, if we're going to be doing the beginner level first, after 2 weeks, if this is totally easy, move on to the next level. Once that becomes easy, move on to the next level. But sort of suss out where you are and what range of motion you have. None of these exercises should create sharp pain. And if any of these create sharp pain, I want you to stop right away. And you can always message me. I can give you some specifics, but a little bit of dull, a little bit of ache, this is okay. The whole thing is we need to get the shoulder girdle to restabilize in a posterior and inferior position. This holds the shoulder into the right place. That shuts off the scalene muscles and upper trap, and that's going to disengage that impingement on the nerve. And all this mobility is going to break up that scar tissue in the joint capsule, relieving some of that inflammation. So we're going to be doing 4 sets of everything. We're going to be moving with our breath, kind of like you would do with traditional Western workout, going to the gym. We are going to connect to our breath and our body to our breath in a Qigong fashion. And these are all going to be calisthenic done on the floor. So I'm going to be turning sideways so that you can see all the movements. And we're going to be doing 10 breaths with each movement, or 10 repetitions with each movement. We're going to go through 4 different exercises, and we're going to do it as what's called a circuit. So we're going to do 4 exercises in a row, then take a quick break, and we'll start again, and we're going to go through that 4 times. It's going to take us about 20 minutes. So with that in mind, let's ease on down to all 4s. So we're going to very gently come on down to all 4s, or what's known as tabletop position. Your knees are going to be hip width apart. Your hands are going to be shoulder width apart. And what I want you to do is I want you to engage your stomach. I want you to pull your stomach in, so pull your belly button into your spine. And we always want to connect our core with whatever girdle, whether it's shoulder girdle or pelvic girdle. We always want to connect core integration into any kind of stability movements. And this is really important when we do rehab, but any kind of structural work where we're strengthening our body. So first off is very simple. We're going to move through a piston movement. So what we're going to do here is we're going to tighten the tummy first, and we're going to allow our chest to drop so our shoulder blades come together. So I don't want you sticking your head down. Your head is going to stay neutral, not looking up, just going to stay neutral at all times. I just want you to drop your chest till you feel your shoulder blades come together. And here we're going to take a deep breath in. And as you breathe out, you're going to push away as far as you can till your shoulder blades are stretched wide apart. Breathe in, drop down. Breathe out, push away. Breathe in, drop down. Breathe out, push away. Breathe in, drop down. Right till the shoulder blades come tight. Breathe out, push away. Breathe in, drop down. Breathe out, push away. Breathe in, drop down. Shoulder blades totally tight. Breathe out, push away. Shoulder blades totally spread. Breathe in, drop down. Breathe out, push away. Breathe in, drop down. Breathe out, push away. Breathe in, drop down. Breathe out, push away. And breathe in, drop down. And breathe out, push away. Beautiful. So next we're going to move to some thoracic rotation. Basically what you're going to do is we're going to start with the left hand. You're just going to place your left hand on your head. Now we're going to be doing both sides. If you have frozen shoulder on the left side or the right side, doesn't matter because we're going to be doing both sides. So you're going to stabilize with the right hand first, and you're going to place your left hand beside your ear, and we're going to take a breath in here. And then I want you to gently just lift up the elbows wherever it lifts up to. Now if you can only lift a little bit, that's totally okay. Each time you do it, you'll be able to lift a little bit higher. So take a breath in. Breathe out and lift. Breathe in, drop down. Breathe out, lift. Breathe in. Breathe out. 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 Breathe in. And breathe out. Beautiful. Now we're going to switch hands. Place the left hand down, right hand beside the head. Here we go again. Breathe in. Breathe out. 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 Breathe in. And breathe out. Beautiful. Placing both hands back down. Now we're going to move to a rowing motion, basically a one-arm row. And we're going to rub the elbow and the hand against the body as we pull back. So we're going to start with the left hand. So we're going to take a breath in here first, just like before. And as we breathe out, I want you to pull it right against the side of your body, as high as you can, breathing out. Breathe in. Breathe out. Breathe in. Breathe out. We'll keep alternating. Breathe in. Breathe out. Breathe in. Breathe out. Breathe in. Breathe out. Breathe in. Breathe out. Keep it very tight to your body. Breathe in. Breathe out. 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 Breathe in. Beautiful. Now, so much of healing the shoulder is yes, strength, but it's flexibility, range of motion, muscular stability. And the mobility part, the movement part is so super important here. Now, the last exercise is about pressing down, because so much of the time when this becomes contracted, what happens is pec minor becomes very tight, rolls the shoulder forward, and when that happens, upper trap becomes chronically engaged and the shoulder elevates, and that's where we get that contraction. So we need to actually push down, and that's what engages the lats and lower traps. So we're going to bend our knees, heels on the floor, and we're just going to place our palms back just like we're relaxing on the beach. And all I want you to do is pressing through your hands. I just want you to lift your bum off the ground, just whatever you can lift it up. So we're going to take a breath in and just push off the ground. Breathe in, breathe out, push. In 3, push. In 4, push. In 5, push. In 6, push. In 7, push. In 8, push. In 9, push. And in 10. And push. Good, relax it on down. And there is your first circuit. So those are your first 4 exercises. We're going to start that all once again. Once again, you want to listen to your body. If you have pain, especially sharp pain, really take it easy. We don't have to fix this in one day. And this is going to take multiple weeks, even at this first level. And like I said, we're going to have 3 different videos, 3 different progressive programs, getting stronger and stronger, getting you back to that fully functional position that you need. Now, a big part of capsulitis is inflammation. And so I really, really, really can't strongly push it hard enough is to reduce, if not remove, inflammatory foods. And that would be wheat, processed dairy, corn, soy, and processed sugar. Raw dairy, okay. If you're in Canada, you get raw cheese or you get fermented dairy like kefir, absolutely okay. But any processed cheese, processed milk, no. And the other thing is anything that contains lectins. Lectins are a defense chemical that are in the seeds and roots of plants. So this would be grains, wheat, oats, beans, nuts, seeds. These guys actually damage our gut lining, and these do cause autoimmune reactions. So anything with lectins, we really want to try to avoid as much as possible. And I know that's a lot of the healthy food that people eat, or seemingly healthy food. But when we're trying to heal from an inflammatory condition, we don't want foods that cause inflammation. All right, round 2. So let's head back to our tabletop position, and we're going to start once again with our pistons. So we're going to drop the chest down until the shoulder blades come together, and we're going to breathe in here, and we breathe out, pushing away. In 2, push away. In 3, push away. In 4, push away. In 5, push away. In 6, feel those shoulder blades touch. Push away. In 7, push away. In 8, push away. In 9, push away. And in 10, push away. Good. Remember, at all times, keeping that tummy nice and tight, pulling the belly button into the spine, connecting your core to the shoulder girdle. Now we move through thoracic rotation. Hand on the head. We breathe in here. We breathe out as we rotate. In 2. Out. In 3. Out. In 4. Out. In 5. Out. In 6. Out. In 7. Out. In 8. Out. In 9. Out. And in 10. And out. Beautiful. Left hand down. Let's do the same thing with the right. Remember, keeping that core tight at all times. Breathing in here. Breathe out, rotate. In 2. Out. In 3. Out. In 4. Out. In 5. Out. In 6. Out. in 7, out, in 8, out, in 9, out, and in 10, and out. Good, hands back down. Now we're going to do our one-arm rows where we're going to alternate. So we're doing 10 on each side. So we breathe in first. Remember, core is tight. Breathing in. Left hand rubs up. Breathing out. Breathing in. Right hand. Breathing in. In 2. In. 2. In. 3. In. 3. In. 4. Remember, keep that elbow right against your body. In. 4. In. 5. Lift that elbow as high as you can. In. 5. In. 6. In. 6. In. 7. In. 7. In. 8. In. 8. Pull it back high. In. 9. In. 9. In. 10. In. And 10. In. Beautiful. Flipping over. Back to our relaxing position. Hands beneath the hips. Bring the knees in. Weight is on the heels and the hands. You just try to lift the bum off the ground. So just push up a little bit. Deep breath in. Lift up. Breathe in, drop. Breathe out, lift. In 3. Out. In 4. Out. In 5. Lift. In 6. Lift. In 7. Out. In 8. Lift. In 9. Lift. And in 10. Lift. Beautiful. Relax it on down. So that's our second set. Once again, nice and easy, using pain as your guide. Once again, sharp pain we do not want. An ache or an uncomfortable sensation, this is okay in this particular thing. And you're going to have some discomfort, for sure. The inflammation and all the scar tissue that's in there, that's what has to break down. And that's why moving through range of motion is so key. Moving through mobility is so key. And I know when we're in pain, we don't want to move. We don't feel like moving because we're worried about irritating it. But the only way to heal this is to move it. The more movement, the better it feels. All right, let's hit round 3. Back to our tabletop. Remember, engaging the tummy at all times. And we're going to start with our pistons. So we're going to drop the chest down till the shoulder blades touch, but the belly is tight. We take a breath in here, and we push away. In 2, and push. In 3, and push. So remember, the bigger the range, the better. In 4, push. In 5, push. In 6, push. In 7, push. In 8, push. In 9, push. And in 10, and push. Beautiful. Drop it back down. Okay, now we move to rotation. Once again, we'll start with the left hand, lifting to wherever you can comfortably without pain, always trying to increase range of motion as much as you possibly can. So, take a breath in, Breathe out, lift. In 2, lift. In 3, lift. In 4, lift. In 5, lift. In 6, lift. In 7, lift. In 8, lift. In 9, lift. And in 10, lift. Beautiful. Let's switch sides now. The right hand. So left hand is supporting, right hand on the head, abs engaged. Deep breath in. Breathe out, lift. In 2, lift. In 3, lift. In 4, lift. In 5, lift. In 6, lift. In 7, lift. In 8, lift. In 9, lift. And in 10, lift. Beautiful. Dropping those hands back down. Now we do our alternating row, 10 counts on each side. So starting with the left, remember that the elbow and hand rub against the side of the body as you lift and pull it as high as you can. Deep breath in. Breathe out, lift. In. 1. In. Left. In. 2. In. Left. In. 3. In. Left. In. 4. In. Left. In. 5. In. Left. In. 6. In. Left. In. 7. In. 8. In. In. Left. And in. 10. Beautiful. All right, gently easing back onto our crab position. Heels bent. And we're just pressing down, just lifting the hips off the ground. Deep breath in. Lift. In 2. Lift. In 3. Lift. In 4. Lift. In 5. Lift. In 6. Lift. In 7. Lift. In 8. Lift. In 9. Lift. And in 10. And lift. Beautiful. Relax it on down. That is 3 sets. We got one last set to go. Typically using 4 sets to fully exhaust and fully recruit all the muscle fiber. And once again, you may have noticed, for those who understand their meridians, lung and large intestine, these are the channels that run through the shoulder and down the arm, through the neck. These are the guys that there's pathology in, that we actually get chi stagnation, chi and blood stagnation. That's that sharp pain. Whereas the achy pain is chi stagnation. So whether you have chi or qi and blood. Either way, typically is through the large intestine and lung channel, and some of the gallbladder channel that runs through there can also be involved. We got one last set to go. Here we go. So, back to our tabletop. Abs are engaged, and we're going to start with our pistons. So we drop the chest down. Take a breath in, and breathe out and lift. In 2, lift. In 3, lift. In 4, lift. In 5, lift. In 6, lift. In 7, lift. In 8, lift. In 9, lift. And in 10, lift. Beautiful. Now we go through rotation. Left hand on the head. Abs are tight. Breathing in here. Breathe out, rotate. In 2, lift. In 3, breathe out, lift. In 4, in 5, lift. In 6, lift. In 7, lift. In 8, lift. In 9, lift. And in 10, lift. Beautiful. Switching sides. Left hand down, right hand up. Breathing in here. Breathing out, lift. In 2, lift. In 3, and lift. In 4, and lift. In 5, breathe out, lift. In 6, and lift. In 7, and lift. In 8, and lift. In 9, and lift. And in 10, and lift. Beautiful. All right. Now we move to our alternating rows. And remember, as it pulls up, elbow comes tight against the body, hand comes tight against the body, trying to lift that elbow as high as you possibly can. Keep that head neutral at all times. So 10 on each side. Here we go. Deep breath in. Left hand up. Breathe in. Right hand. Breathe in. Left hand 2. Breathe in. Right hand 2. Breathe in. Left hand 3. Breathe in. Right hand 3. Breathe in. Left hand 4. Breathe in. Right hand 4. Breathe in. Left hand 5. Breathe in. Right hand 5. Breathe in. Left hand 6. Breathe in. Right hand 6. Breathe in. Left hand 7. Breathe in. Right hand 7. Breathe in. Left hand 8. Breathe in. Right hand 8. Breathe in. Left hand 9. Breathe in. Right hand 9. Breathe in. Left hand 10. Breathe in. Right hand 10. Breathe in. Beautiful. All right, last one. Back to our crab position. Heel of the palm down. Knees bent. Weight on the heels. Take a breath in. Lift up. Drop down, breathe in. Lift up. In 3. Lift up. In 4. Lift up. In 5. Lift up. In 6. Lift up. In 7. Lift up. In 8. Lift up. In 9. Lift up. And in 10. Lift up. Good. Gently lower the body back down. All right, let's very gently ease on up to our feet. Nice and easy. And let's finish off like we finish every program with a few cleansing breaths. Deep breath in and out. In 2 and out. One last one. As slowly as possible, gather the light. Pulling it down, melting over your body. At the bottom, raise a little wisdom water of the kidney and wash down the heart fire. So, well done. Well, ladies and gents, this is our first level. And once again, not only women get a frozen shoulder, but the specific menopausal shoulder that we do see so much, the frozen shoulder that we do see at menopause is unfortunately a female condition. But this program will actually be for anyone who gets frozen shoulder or adhesive capsulitis or thoracic outlet syndrome, any kind of pain through the shoulder, this will help. Remember, we have 3 different levels, so do this one for a couple weeks. Once it feels pretty easy, move up to the next level once that feels, and listen to your body. After a few weeks, then you can move up to the next level. Remember, check out bodhi-medicalqigong.com, our brand new website only launched 2 weeks ago, our new member site, where we'll be having our live classes. First one this coming Saturday at 9 a.m. Eastern Standard Time, and I hope to see you guys all there. It's really, I'm so excited for this new reservoir of information, this new library of information that people will access and really help to keep their body healthy. So thanks so much. Hope you enjoyed. See you next time.